Hi, I'm Yusuf Osman, Dean of the Dental Faculty at the University of the Western Cape, in the Western Cape in South Africa. My position is a dual position with the provincial government and the university. At the provincial government, I'm the manager of the oral health centers, and at the university, I'm the dean of the faculty. So it has a dual responsibility, reports to two bosses as such. In just before about 1990, we were at the University of Stellenbosch's Tygerberg campus. And at that stage, the Stellenbosch University wanted to expand, and they gave us notice to move, hoping to incorporate us into their structures. But at that stage, Professor Jakes Gerwel felt that the university needed to be on its own. He looked around for a site and thought the best would be a community-based site in the Western Cape. And the most appropriate site happened to be Mitchell's Plain. There's a large population of over 500,000 in Mitchell's Plain, largely unemployed, middle to poor socioeconomic status, with feeder areas from Khayelitsha, Gugulethu. So it seemed like an excellent community-based site. There was also a lack of comprehensive oral health services in Mitchell's Plain at that stage, because it was predominantly practitioners from Sea Point and Camps Bay that would come to Mitchell's Plain, just do extractions and go away. So the people in Mitchell's Plain got the rough end of the stick. And Professor Gerwel decided that he'd move the faculty to Mitchell's Plain. Mediclinic at that stage, that were the owners of this building, were running at a loss in this building. So they needed to sell. So the university bought 2.5 floors of this building for its training facilities. And that must have been the wisest move ever, because it gave the university an excellent training ground, but it also gave the people of Mitchell's Plain access to comprehensive dental services. For the first time, they were going to get things like crowns and bridges and things like that. The town center is so well located because the bus stops are here, the central bus station is here, the train station is here. So people from Khayelitsha, from Crossroads, from Gugulethu find it easy to get to Mitchell's Plain. So, and this is a hub. And they come, they do their shopping, they have their oral health services. So it's a one-stop stop. So they get everything done in one stop. If we look at the burden of oral health in the Western Cape, it's got the largest number of 6-year-olds and below that have caries. If you took any 6-year-old in the street, they'd have at least 4, 5, 6 rotten teeth in their mouth. The chart behind me actually tells you about that. It's the highest caries rate. In the Western Cape, there was also a trend to have teeth extracted. So it's got one of the highest rates of people without teeth needing dentures. So this community, and they don't have the money. So here you have a community that is faced with the largest burden of oral health disease, and they cannot access oral health care. So with the university coming here, we needed a training ground for our students. And this was an excellent symbiotic relationship, where our students would get the training, the community would get the services, and it's a win-win situation for everybody. It's, in fact, every external examiner that came to our university is envious of our student population and our patient population. We see in excess of 120,000 patients a year. So there isn't a student that can say they didn't have a chance to do something in their training. So, but that meant we needed to get involved with the community. And this was from grassroots. So we got into the primary schools, we got into the creches, we got into the old age homes. We got in everywhere we knew people were having difficulty accessing services. And we said, here we are. Come to us and we'll do it together. And it's worked well. The partnership has worked very well. We're based at the faculty here in Tygerberg, but there are so many places out there that don't have any services. Like there's a place in Visantekraal, there's in Vredenburg, there's in Saldanha. There are places that don't have access to health services. And they asked us if we can't come out there. So we've got this truck. We've got 2 dental chairs on this truck. And then we get together with the local clinic or the local primary school. We go out there for a weekend. We go the Friday afternoon, set up camp. The whole of the Saturday we work, and the Sunday we work, and Sunday evening we come back. We see about 350 patients over that weekend. But it's people that would not have got care in other ways. The thing is, for our students, it's also good because for the first time they treat patients in their environment. So they see the social context, where people live, how they queue long hours just to get treatment. And this makes it an excellent relationship. So the outreach programs, we do about 5 of them, 5 weekends a year. And then we have day clinics where we go to say to noon for the day. And we set up our mobile unit, these 2 chairs, and we link up with the primary school. And we see all the grade 1 and the grade 2 children over that Saturday morning. We go to Hangburg in Hout Bay. So we have all these, we identify spots. For next year, we want to organize it a little bit. We want the districts to apply to us to say, come out to the districts. And we will hopefully try and accommodate as many as possible on a rotation basis. Yeah, I think people are most familiar with the relief of pain and sepsis. So it's like extractions and getting rid of infection. But we provide more than that. We provide general scalings and polishings, that's cleaning teeth. We provide conventional fillings. We provide advanced fillings like crowns, bridges. We even do implants, and we do dentures. So we provide the whole spectrum. The thing is, our programs are accredited with the Health Professions Council. So our undergraduates and postgraduates have been accredited by the council. And that implies that the training must meet certain requirements, regulations. So the full spectrum of services are offered. All specialist programs that are trained, all specialists that are trained here offer the full spectrum of services. Now, cost is a problem because you cannot afford all these major cost factors. So if patients can pay for some components, we assist them. We do the services for free. If they can't, we try and raise money so that we still give them the best of services, but at reduced cost. It does. It's unfortunate. I think because of our large clinical exposure, we have requests from all over the world. We get students from Sweden, we get students from the UK, students from Germany that want to come and spend time with us. The thing is, our faculty is based at 2 main sites, that's Tygerberg and Mitchell's Plain, but we have many outlying sites, like we have a clinic in Guguletu, we have a clinic at Red Cross Hospital, so the exposure is varied. And some of these students come here and spend maybe 2 weeks or 3 weeks, and in that 3 weeks they do more clinical work than they've done in a whole year in their host country. So we're very popular with countries, but we cannot accommodate all of them because our students are our first responsibility. We try to be as cooperative as we can with these foreign students, but we can only take in a limited number. We partner with the University of Missouri in Kansas City, and we also partner with the University of Oslo in Norway. But other than that, the other requests we try and manage on an ad hoc basis. This faculty is the only faculty in the country that's designated a World Health Organization collaborating center. The implications of that are that it's supposed to assist Central, Western, Eastern Africa with their research and their proposals. This means that we are inundated with assisting and coordinating research. One task that was left to us when HIV/AIDS became just so widely prevalent, the faculty was asked to prepare documents in English, in French, and in Portuguese for distribution in Africa with signs and symptoms of HIV and AIDS that oral health practitioners could see and pick up. Sometimes patients with HIV and AIDS, the first practitioner they see is an oral health practitioner. So those practitioners need to be knowledgeable about what they need to look for. So we prepared these documents. This was funded by Old Mutual, and we spread it across Africa. Like that, we get tasked. We also host the cancer registry for oral health for the Western Cape. We're coordinating a cancer project where we're going to look at oral cancer in the Western Cape, and that's going to be based at the University of the Western Cape. So we're hoping in Africa, at our last meeting in Morocco, where all deans of dental schools met, our faculty was the biggest faculty represented at that meeting. So currently, I think we enjoy a good reputation internationally. This clinic is the prosthetics clinic. It's the false teeth, the denture clinic. That's Professor Vivian Wilson, and she's going to give us a demonstration. She's the head and professor in the Department of Prosthodontics.
Okay, I'm Vivian Wilson. I'm the head of restorative dentistry. And restorative dentistry, we see patients that need removable dentures as well as fixed dentures. So in this clinic, we are treating patients that need either partial dentures or complete dentures. Now in the Western Cape, we've got quite a large contingent of patients that are edentulous. In fact, our waiting list at the faculty is about 2 years. Patients that had their teeth extracted many years ago, they're struggling with new dentures, and because the outside clinics, the state health clinics, cannot cater for them, most of the patients are referred to the dental faculty. Most of the patients are being seen by students as well as staff, and we actually cannot treat all the patients that come here for treatment, which is quite a sad state, because 2 years for waiting for, some people have to wait 2 years before they're called in to have their dentures made. Mrs. Lucas Adele is one of our assistants. We've got 2 dental assistants that's assisting with the students, booking of patients, mixing, making sure that patients come in for treatment, booking our patients, basically seeing that it's a well-oiled business that's happening here in this clinic. This is Dr. Emil Prince. He's one of our staff members. And at the moment, he's taking impressions for a patient that will need complete dentures. So the procedure is usually starting with impressions so that we can have the patient's mouth sort of in the lab that we can work on. Materials he's using. So at the moment, he's taking an upper impression with impression material for the patient that's fairly nice and relaxed.
Yeah.
And you can see he's doing a very good job of it.
This is the busiest section in the hospital. And the reason being that this is where most of the pain and sepsis is treated. So they go through at least 50 patients every morning. And it's without a doubt, in fact, more than that if we left the doors open.
I'm Dr. Harding. This is the Maxillofacial and Oral Surgery Department, University of Western Cape, Faculty of Dentistry. Here, basically, we have 2 sites. This is the Mitchell's Plain site, where we teach our undergrad students in this particular clinic. Okay, we will see our 3rd year, 4th year, 5th year dental students, as well as our oral hygiene students. In terms of what we do service rendering to patients who come in for dental extractions mostly. It's not to say that is all we do, but our undergrad students from 3rd year through to 5th year will do basic dental extractions as well as surgical removal of impacted teeth. We have a theatre facility which is now not run here, but it's at our other site. So anything which we cannot handle here, we may refer to our Tygerberg site, and either our consultants or our registrars will see the patients on that side. In terms of the numbers which we see here, it varies depending on the time of the year, because really our students manage a big load of the patients who are seen at this clinic. So for example, if it's January, our numbers will be a little bit lower because our students start usually late January. And then December we don't have students either. But on average, I would say that we see approximately 400, 450 patients per month. That's patients, that's heads, feet that come in, as we say, bums on the chair. And but in terms of numbers of teeth extracted, there we're looking at over 1,000 per month, which is not really a good thing that we, but in terms of managing sepsis and so forth, it does alleviate pain to patients. Look, restorative is our main, we actually teach our students, the aim is to save a tooth or to restore function. So yes, by the time we see patients here, in this particular clinic, they've gone through a process of screening. At screening, they will then be directed to either having the tooth restored or the patients who come in for dentures. But by the time they hit this clinic, it's mostly extractions. I would say 98% of the time we are going to extract. If it is for facial pain, it may not be a case where we will extract. It may be a joint problem, okay, and that may end up as a surgical case or a prosthetic case. But 98% of the patients who end up in this clinic will leave without 1 or 2 teeth. The program functions such that this type of work is quite invasive. So it's really from our 3rd year students, the dental students, where they enter this clinic. And that would be in the 2nd semester. So if we look at our 3rd year dentistry, 4th year and 5th year dentistry students, you're looking at approximately 250 students. With regard to the oral hygiene students, they enter the clinic in their second year of training. So no, they don't extract teeth, but they do anesthetize patients. So it's in this department where they have the opportunity to anesthetize the patient and assist with other surgical procedures.
I'm Mrs. Erasmus and I'm the supervisor in the sterilization department. From here, the sterilization is actually the heart of the dental faculty. From here we get our instruments ready for the different procedures. That is now for extractions, for surgeries, for everything done in the faculty. And we sterilize the instruments here, and from here, from this side, that's actually the side where we clean the instruments, we sterilize it, we disinfect first. We just get it in from this side, that is the window where they bring the instruments back for us, for the dirty instruments. Then we check it, we first disinfect it, and then we pack it from that side. And here we've got all the sealers. That is a sealer. We seal the different instruments here with a packet called a Steripeel. Then we seal the packet and then it's ready for sterilization. We put it in a wire racks on that side. And from here we put it into the autoclave where it gets about 134 degrees to sterilize it. And it's about up to 20 minutes for the open packets. The packets that is wrapped with a cloth, we do it for about 40 minutes. And then it's ready, it's sterilized. And from the autoclave, we just cool it off on this side. And we put it in the different packages, and then it's ready for the procedures on the other side. We've got two sides. The side is for the cleaning, and on the other side is for the sterilized packets. This is actually the side we keep all the sterilized packets for issuing, and all the packets is in here, the basic sets for cons and all the different procedures. Then we issue it from this side. The window here is actually for issuing. Then we use a card. That is a card for the different students, and the student must write on this card what he needs for the day or the session, and then they put it on here, and it's for us to control and to check whether packets go out from the sterilization department. So at the end of the day or the session, we get it back and we check it from the card with the student.
Okay, my name is Dr. Buyani Dubula. I'm from the Northern Cape, sent here to do specialization by the province in orthodontics. Basically, what we do now, I'm getting trained to go back and specialize orthodontic treatment in the Northern Cape, Kimberley and the surrounding areas. Currently, I'm on my third year of studying. I hope to finish in record time in 4 years. But currently, everything is going well according to the planned schedule. And I'm very excited to be part of this training. And I'm also very excited to receive the training from this institution. I also did my undergrad training in dentistry here in the University of Western Cape. And I'm very proud to be here. Orthodontics entail straightening of the teeth. Currently, young children, there's a trend of them coming with very skewed teeth. And sometimes it's not only the teeth, also the jaws are not proportionate. You'll find the lower jaw being bigger than the upper jaw. So it also includes not only the teeth, but also straightening the jaw and cutting them so that they are in a correct proportion.
I'm Dr. Tiernison, orthodontist in the Orthodontic Department. We basically put braces on the teeth and straighten up the teeth. We also work in conjunction with other departments to line up the teeth for the multidisciplinary approach of treatment. The specialist training normally proceeds over 4 years. There's a long waiting list for students trying to get in. We normally have like 30 applicants and take to post. Students are only eligible after they've completed 2 years post-training. Then they apply, get into primaries, and then treat approximately 100 cases and present 20 at the end of the 4 years. Essentially, we dictated to by Department of Health, and students are chosen on merit. We look at demographics, both in the profession and following the country's racial profile. So then at the end of the day, we make decisions, shortlist the students, and then the Department of Health as the final say, because they're the paymaster. Because there's a belief that everyone can, if they're qualified, can do a speciality, given the opportunity.
Einde van 2013 was die waglys 817. Ons het nou weer getel dat meer pasiënte bygekom omdat Tygerbergse waglyse toegemaak en baie pasiënte word hiernatoe refer. Die tipe pasiënte wat op die lang waglys is vir die nagraadse studente. Dan het ons 'n korter waglys wat deur die ondergraadse studente gedoen het, maar omdat daar meer studente is in die ondergraads as in die nagraads, word hy waglys taamlik vinnig gedoen. Daar's nooit pasiënte wat lank wag nie. Hulle langste wagperiode is omtrent 'n maand of 2 maande. Dit is vir ondergraads, maar die een sê ons vir pasiënte, dit kan tot op 4 of 3 jaar wees vir die waglys. Ja, die pasiënte is taamlik teleurgestel as hulle nie dadelik gehelp kan word nie, maar ons maak seker dat ons vir hulle inlig as hulle kom vir 'n konsultasie. Ons wil nie onnodig hulle expectations raise nie. So ons sê vir hulle wat is die stand van sake. Ons lig vir hulle in. En sê dan ook vir hulle hoe lank neem dit om vir die behandeling, enige iets van 1,5 tot 3 jaar. En ons het net 'n paar gespesialiseerde tandartse wat daarin spesialiseer. Dit is ook om die waglys so lank is. En dan lyk dit of hulle 'n bietjie verstaan. Ja. Maar daar is 'n groot aanvraag vir ortodontiese.